Your heart has a gas pedal and a brake pedal. The brake pedal is called the vagus nerve. Today, we'll talk about how this nerve slows your heart, when palpitations are normal versus dangerous, and what the science says when your heart suddenly races. Most importantly, I'll be clear about which symptoms mean you should go to the emergency room without waiting. The vagus nerve is the main parasympathetic line between your brain and internal organs, the lead player of the rest and digest system. When it comes to the heart, its job is to brake, to lower heart rate and calm the rhythm. A window into how well that brake works is the tiny timing differences between beats, heart rate variability, or HRV. In general, higher HRV is associated with better autonomic balance and better heart health. But note, HRV is an indicator, not a diagnosis on its own. Now to some concrete science. There's a specific type of fast rhythm, supraventricular tachycardia, or SVT, episodes where the heart suddenly beats very fast. In these, maneuvers that stimulate the vagus nerve can restore a normal rhythm. A randomized trial added a simple change to the classic Valsalva maneuver. Right after the strained breath hold, lie back and raise the legs. The result was striking. The standard method returned 17% of patients to normal, while this modified version returned 43%, with no serious adverse events. But this is crucial. This is a tool taught for SVT that a doctor has diagnosed. It's not for self-diagnosis. And never massage your neck or carotid artery. That's dangerous. Now the most important part. When is a palpitation normal, and when is it an alarm? An occasional skipped or thumping beat that comes and goes with coffee, stress, poor sleep, or excitement is usually benign. But if these symptoms accompany it, get emergency help without waiting. Chest pain or pressure with the palpitations, fainting or nearly fainting, severe shortness of breath, or a very fast, irregular heartbeat that won't stop. If there's a family history of sudden cardiac death at a young age, discuss that with your doctor too. In short, a brief palpitation on its own is usually fine. A palpitation with another serious symptom means urgent evaluation. So can we support this brake, this autonomic balance? The levers the evidence points to are familiar. Regular aerobic exercise, good sleep, stress management, and slow, deep breathing all help autonomic balance and can raise HRV over time. But don't over-index on gadgets. Tracking HRV can be a useful habit, but a single low day isn't cause for panic. The direction matters, not one day. To recap, the vagus nerve is your heart's brake. How well it works is a window into your health. In certain fast rhythms, the modified Valsalva helps, but under a doctor's guidance. Most importantly, know your own normal. Know the red flags. With chest pain, fainting, or severe breathlessness accompanying palpitations, go to the emergency room without waiting, and support the brake with fitness, sleep, and breathing. Next episodes, we'll enter the series' most debated topics, statins and toxins, with balance. This isn't medical advice. For your own case, see your doctor. Measure, move, live longer, subscribe.